Tanner heads up research into a variety of domestic policies with a particular emphasis on healthcare reform, social welfare policy, and Social Security. His most recent book, Leviathan on the Right, How Big Government Conservatism Brought Down the Republican Revolution, chronicles the demise of the Republican Party as it has shifted away from the limited government roots and warns that reform is necessary to avoid continual electoral defeat. Under Tanner's direction, Cato launched the project on Social Security Choice, which is widely considered the leading impetus for transforming the soon-to-be bankrupt system into a private savings program. Time magazine calls Mr. Tanner one of the architects of the private accounts movement, and Congressional Quarterly named him one of the nation's 5 most influential experts on Social Security. His other books include Healthy Competition, What's Holding Back Health Care and How to Free It, The Poverty of Welfare, Helping Others in Civil Society, and A New Deal for Social Security. Tanner's writings have appeared in nearly every major American newspaper, including the New York Times, Washington Post, Los Angeles Times, Wall Street Journal, and USA Today. A prolific writer and frequent guest lecturer, Tanner appears regularly on network and cable news programs. Before joining Cato in 1993, Tanner served as Director of Research of the Georgia Public Policy Foundation and as Legislative Director for the American Legislative Exchange Council. With that, I'd like to welcome Mr. Tanner.
Well, thank you very much. I do appreciate the opportunity to be here. Thanks for having me up. Thanks for getting me out of Washington, even if just for a couple of hours. That's always a treat. It is, I have to say, an advantage of my job is that I get to travel so much. I've actually been in 49 states in the last 5 years to talk about healthcare and other issues. So I've gotten to see an awful lot of this country. I've also gotten to travel a great deal internationally. I've been in probably about 20 countries over the last 5-10 years or so. I get to see that. Most recently, actually, in the spring, I was over in the UK. I understand we got someone here from the UK. I was actually over there this spring. In my free time, I went for a run in Hyde Park, which I guess is the thing to do, and I have to say, beautiful park. I really loved it there. But one of the interesting things about Hyde Park, of course, is that there's a speaker's corner, and there's actually a soapbox that's built right into the sidewalk. And anyone can come along, and you can just get up on the soapbox and you can start talking. And you can talk for as long as you want, and it doesn't even matter if you know what you're talking about. It's kind of just like Congress. Well, the day I was there, at any rate, I started to run by and I saw this big crowd, and there was a fellow up on the soapbox, and he was kind of in mid-speech, and he was saying, when the common man takes over, we'll all be drinking champagne. But from the very back of the crowd, this little man spoke up and said, yeah, but me and me mates, we kind of likes our brew. Well, the speaker just sort of ignored that, and he went on and he said, when the common man takes over, we'll all be wearing tuxedos. But sure enough, back of the crowd, that little man says, yeah, but me and me mates, we kind of likes our tweed. Well, the speaker now is getting a little bit upset, but he carried on, and he said, when the common man takes over, we'll all be smoking big cigars. Sure enough, from the back of the crowd came that little man again saying, yeah, but me and me mates, we sort of likes our pipe. Well, the speaker jumped down off the soapbox, and he pushed his way through the crowd, and he found that little man. He grabbed him by the lapels, and he said, when the common man takes over, you'll do as you're damn well told. And it put me in the mind of healthcare reform. Because we're told that healthcare reform is about helping the common man, about helping those people in our society that really need help. But if you get beyond the surface rhetoric and you look at the details of what's actually being proposed, you find that we could very well end up with a system under which we all have to do as we're damn well told. So with that in mind, let me see if I can sort of talk a little bit about what is going on in Washington with the healthcare debate. I'd like to sort of set some context for the debate, and then maybe talk a little bit about the bills themselves that are up there right now, and answer some of the questions that I think are most common about that. And then I'll open the whole thing up to your questions and comments, and so wait till you throw things until after we get to that part, and then we'll get that far. So let me try and put this a little bit in context, because I think some of this is left out of the healthcare debate. And one of the most important things is the fact that for all the problems that the U.S. healthcare system faces, and it faces some very serious problems, and I'm going to talk about those at some length. But for all the problems that we face, the U.S. still has some things that really make it among the best healthcare systems in the world. For example, in terms of innovation, the U.S. drives much of the medical innovation around the world. Now, the last 25 Nobel laureates in medicine, 18 either are U.S. citizens or did their research and practice here in the United States. Of all the pharmaceutical products introduced worldwide over the last 40 years, more than half are patented in the U.S. And of non-pharmaceutical medical breakthroughs, ranging from MRIs to transplants, fully 80% were introduced first in the United States. So when it comes to the technology and the innovations and the breakthroughs that help people around the world, much of that takes place here in this country, driven by our system and our research. Second, we have far more choice in this country than they do in many other places around the world. Nowhere near as much choice as I would like to see. And we'll talk about that. But we do have more choice in many ways than a lot of people. You have more choice of doctors. You know, there are actually countries where your doctor is assigned to you based on your street address. If you move into a home and that's your address, there is a doctor who is the primary care physician for that address, and that is the doctor you must go to. We actually, in this country, have a phenomenon where people move to get a better school district. There are countries where people move to get a better medical district. And we have more choice of hospitals, we have more choice of treatment at that hospital, and we have more choice of how you pay for it. So I think in terms of choice, you know, we have some advantages. And then finally, there's the whole question of quality. And I maintain, and more controversially perhaps, but I maintain we still have the finest quality of healthcare. Now, I know there are some studies out there that disagree with this. There's a very famous study. If anybody saw the movie Sicko, Michael Moore's very funny movie, he quotes a study by the World Health Organization that shows that when it comes to quality of healthcare, the U.S. ranks 37th in the world, right there above Slovenia. Now, that study, I've read that study, and it has a couple of small problems. Primarily the fact that it has very little to actually do with healthcare. For example, in that study, the U.S. was marked down because we don't have a sufficiently progressive income tax in this country. We also lost points for things like not having a sufficient national anti-smoking campaign. When it actually came to criteria like quality and patient satisfaction, we ranked number 1, but that only counted for 15% of the results in the study. Even when they use more objective criteria in that study and elsewhere, I think there are problems. One of the things they use in this study, but you hear it all the time mentioned, is the fact that when it comes to life expectancy, other countries do better than the U.S. People live longer in Canada and Britain and in other places, so therefore it says they must have better healthcare systems. Well, the only problem with that is very few health economists would say that life expectancy is a good measure of a healthcare system. And I actually recommend a study by two University of Pennsylvania professors, Professor Ho and I forget the other one now, but they did a terrific study on this. I can look that up after.